regular programming for a live briefing from the South Korean health authorities on the coronavirus outbreak. We will be crossing over to the briefing with simultaneous interpretation in English. As of Saturday, South Korea has reported 824 new COVID-19 cases, most of which are concentrated in the capital area. The country has recently reported 4 additional COVID-19 cases of the UK-linked mutated variant and its first case of the South Africa-linked strain. And the government decided today to extend social distancing level 2.5 in the capital area and level 2 in other regions for 2 more weeks. The briefing is just about to start. Let's take a look. U.S. biotech company Moderna will begin supplying the nation with its new coronavirus vaccine in May. And the government is just about to start briefing, so let's just have a look.
We will now begin our regular briefing for January 2nd. First of all, we have Director Im Soo-kyung with the explanation. Let us now begin our regular briefing for the COVID-19 situation here in South Korea. As of January 2nd, at midnight, we have 788 new local infections and 36 new imported cases. The total caseload now stands at 62,593. And we had a total of 33,481 cases that were tested with suspected symptoms. And in the metropolitan area at the makeshift testing sites, we had over 20,000 tests conducted, and a total of 53,540 tests were conducted on a daily basis. And today, our newly confirmed cases stands at 824, and among them, a total of 91 have been tested positive at the makeshift testing sites. Currently, we have a total of 18,073 people in quarantine, while 361 patients are with severe or critical conditions. We had 25 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Here are major updates on our domestic infections during the past week on a daily basis. Nationwide, we have seen about 788 new domestic cases, and in the metropolitan area on a daily basis, we have had 538 cases on average. And as for the major cluster infections, here are some details. At the correctional facility in Seoul Songpa-gu district, the total cases now stands at 598. And in Seoul's Gurogu district, in relation to a nursing hospital there, we have 7 additional cases, and now the accumulated cases stands at 200 to date. And in Gyeonggi-do province, in relation to a religious facility in Suwon City, we have identified earlier 9 additional cases, and a total of 10 cases have been confirmed to date. And in Ulsan City, in relation to a religious center there in the Junggu district, we also have 11 more cases, and a total of 100 cases have been confirmed to date. This is in relation to a mission group. And also next, as for the new variant of the COVID-19 stemming from the Britain, we will have some updates on our response measures currently. As for the UK, a new variant, we have identified 9 cases, and also 1 case of South Africa new variant, and a total of 10 new variant cases have been confirmed so far here in South Korea. We had a total of 5 new cases as of yesterday, and as of midnight today, we have 5 additional cases being confirmed, and among them 4 are related to the UK strain, and also 1 is in relation to the South Africa new variant. And as for these mutations, we are aiming to have a ban on these virus new variants from coming into Korea, and we will be intensifying our quarantine measures as well for all foreign entrants. We will be having the PCR negative document to be submitted for everyone, and also we are having visa issuance restrictions as well. So these are also being conducted. And however, as we have more countries that are seeing the new variant, we are also expanding all of the people, all of the foreigners coming into Korea from elsewhere. They will be subject to mandatory PCR testings. And as for people coming in from flights, we will be mandating them starting from January 8th, while at the ports, we will be beginning from the 15th of January. So they need to submit a PCR negative document that has proven that they are tested negative some 72 hours before their departure. And next here are some updates on our operation extension for the makeshift testing sites at the Seoul metropolitan area and the capital area as well. And starting from the 24th of last month, we also have set up the makeshift testing sites in the metropolitan area. And currently we have 153 centers being operated, and under this time we have conducted over 700,000 cases of tests, and a total of 1,948 people have tested positive at these testing sites. And by types of testings, the nasal swab PCR testing have been conducted for 688,000 tests, and also swift antigen testings has been carried out for 12,000 cases, while about 4,000 cases of the saliva-based PCR testings have tested negative. And also as for the 39 cases that have conducted the swift antigen testings, we have seen about 65% positivity rate by carrying out the second phase nasal swab PCR testings. And during the past 3 weeks or so, we were able to trace down 1,948 patients at these makeshift testing sites. And we believe that these were very effective in tracing down possible patients. However, in the metropolitan area, we are seeing a continued outbreak, and also we have the extended social distancing measures, and we will also extend the makeshift testing sites for the next 2 weeks as well. And during these extensions, we will also we will exclude the conduction of the saliva-based PCR testings, and also we will be operating these centers from 9 a.m. to 5 p.m. in the weekdays and until 1 p.m. in the weekends, considering the increased burden on the medical staff members. And also we will have an adjustment of the number of testings at each centers depending on their local government. So as for the people who are wishing to get tested, we ask you to check in advance with the local governments. And aside from the personnel that are already mobilized to the scene, we will be mobilizing further administrative staff and medical staff members. So as for residents living in the metropolitan area, if you have any suspected symptoms like fever or respiratory symptoms, we ask you to get tested as soon as possible. And next, we have the safety e-reports run by the Safety Ministry, and there was a case of hospitality service that have been reported. And at a casino at a hotel, there were many foreigners who did not abide by social distancing measures, and people did not wear face masks as well. In addition, at pensions, the organizers as well as the users did not wear face masks properly, and also they had handshaking gestures, and also they did not have a clear compliance to the entry log as well. And at guest houses, there were even cases where people over 5 people were gathered in one place and having a party without keeping an eye on the social distancing measures. So we ask you to take particular precautions. In Korea, we are seeing domestic tallies hovering around 1,000. We are not seeing a rapid surge nor a rapid decline in the daily cases. And through the metropolitan testing sites, we are seeing about 100 new tests testing positive at these testing sites, and we are seeing continued outbreak of the third major wave here in South Korea. Nevertheless, we have seen a decline in the amount of foot traffic in the residents in the metropolitan area, decreasing by 34%. And also we have seen a decline in the reproductive rate to stand around 1. So we are seeing some positive changes as well. So these small changes as well as hope also enable us to prolong the COVID-19 battle, and this was all possible thanks to the efforts put forth by many public citizens. And starting from February to March this year, we will have the rollout of the vaccinations against COVID-19, and we will also introduce therapeutics against COVID-19, and we see that we will have a clear improvement in our battle against COVID-19. On top of the live quarantine measures, we will be able to combine the efforts of the vaccines and therapeutics, and we believe that we can have a full control over the COVID-19 as wished by many citizens. In order to do so, it is very utmost for us to contain the virus spread, especially here at the third wave. And the quarantine authorities will continue to conduct massive testings, massive makeshift testing sites, as well as the tracing of the patients and testing of the patients. And in addition, we have seen a new variant spreading across the world, and they are also reportedly having a more higher infectious rate than other strains. So we will also keep a close eye on all foreign entrants, and we will also exert our full efforts to contain the virus spread here in South Korea. So we ask the members of the public to overturn the COVID-19 outbreak here in South Korea. And today, as announced by the government authorities, we ask you to comply with the extended means of the social distancing measures, as well as the year-end holiday quarantine measures as well. Starting January 4th, we will have a nationwide ban on any social gatherings of more than 5 people. So we ask you to get tested as soon as possible if you have symptoms, and wear your face mask at all times. These measures are necessary for us to return back to normal as soon as possible, and also to protect the many lives of the vulnerable class as well as the people in the senior group as well. And this is also a measure to protect the self-employed as well as the medical practitioners who are exerting their full efforts. The quarantine authorities will also exert our full efforts to contain the third wave of the virus as well as any foreign virus entrants. Thank you very much.
That wraps up our coverage of the briefing this afternoon. Thank you for staying with us. We will be back with our regular newscast at 6 p.m. Korea time. Goodbye.
Korea is in the midst of its third wave of COVID-19. Frontline medical workers are fighting COVID-19 in the freezing cold. They warm their icy hands with space heaters and portable hand warmers. Several districts are renovating their testing sites to provide shelter from the cold for